Hi there folks, Michael from First Aid Oz once again. Through our first aid course or through your learning of first aid, you will have come across the acronym Doctors ABCD many times, I'm sure. So Doctors ABCD, again, it's just an acronym. It represents our emergency action plan or our step-by-step procedure that we use to deal with any situation requiring first aid. Now the Doctors ABCD full process is required in more serious situations, but where the situation is fairly minor, okay, there may be an exit point along the way. So if we look at each stage of that acronym, so the first D stands for danger. So when we talk about danger, we primarily mean danger to ourselves, danger to the first aiders, okay? So there are things in the environment that would be obvious dangers, things like electricity and gases and fire, toxic fumes and all those sort of things, which would be very dangerous for us. When you come to those situations, usually they're attended by professionals that have the right apparatus, so the right clothing, the right breathing gear and so on and so forth. But as a first aider, you're not really expected to have that equipment. So you might come across a situation where it's too dangerous for you to proceed. It's not safe. The likelihood that you're also going to become a casualty yourself, which also doesn't help the casualty that's there, we end up with multiple fatalities in that case. So the first assessment, is it safe for me to proceed? Other things which are not as drastic as that, maybe things like the environment. If you're on the surf coast, for example, someone's washed up on the rocks and the waves are crashing in, yeah, that's an unsafe situation. If you've got an incident on the road with a pedestrian or a cyclist or a traffic incident, you know, and you run out on the road to try and help the person, the obvious danger is the traffic. Even if you're there treating the person on the side of the road and the traffic is flying past, it's a high risk environment. What the emergency services often do in that situation is they'll close off the road or cordon off the traffic to make it safe for not only the casualty but also the people trying to help and treat the casualty. And there's one that we often overlook, which is risk of infection and risk of infection to ourselves. So again, in the last couple of years we've had a lot of information out there about COVID and you know, a lot of people's knowledge of infection is much greater than perhaps it was a couple of years ago, but infection control has always been a part of first aid for as long as we've been teaching it, and we've been going more than 15 years. But even, you know, prior to that, there was always the consideration of infection control. So what you need to think about in first aid, again, if you're in a situation perhaps in the workplace and you have a first aid kit accessible, or you might have a first aid kit in the boot of your car or so on, is anytime you're doing first aid, you need to consider putting on gloves. Okay, if you have gloves available, put them on first. First thing you do, put on your rubber gloves. So this is your first barrier for infection, because anything you touch, particularly when it comes to bodily fluids, you have to assume it's infectious, even if it's not. There's no way that you could know. Okay. Other things you might consider is a face shield, some safety goggles and so on. And again, if the person is bleeding, if you know, there's a chance the person will regurgitate or throw up or something like that, and those things can act as a barrier. When it comes to CPR, then you might look at things like face shields and masks and so on and so forth. But anyway, so risk of infection is also a barrier. So you may decide, if there's a lot of blood present, for example, and you don't have any barriers, you may make a decision it's unsafe for me to proceed. Anyway, all of those dangers, if you like, are also applied to the casualty. Okay, so we have a few options in that situation. So where we determine the situation is either safe for us to proceed, so we say no obvious danger present, and we proceed. Okay, or we say, look, the environment is too dangerous, and we've got two choices. We either can remove the danger, so if it's electricity, we can cut the source of the power, those type of things, or we may be able to, where possible, safely move the casualty from the danger. So for example, you know, when the fire brigade or the fire people go into a burning building, they don't stop in there and treat the people in the building. They get them out of the building first, because obviously that's not a safe environment, and that's a no-brainer. So either remove the danger or remove the casualty from the danger, but as safely as possible, because you need to consider they may have other injuries as well. Okay. However, if by leaving them there they're going to perish, then we need to get them out of there. That's our top priority. The fourth option, of course, is that the danger is so extreme and there's nothing we can do. It's even unsafe for us to go in, even to try and move the person. In that case, all we can really do is call emergency services and observe the situation while emergency services is on their way. And if it was to change in that transit period, well, then we can go back to what we spoke about before. So that's dangers. Okay, so danger to yourself as a first aider, danger to the casualty, and probably a lesser consideration is danger to others. If you've got other people there to help you, that would be great, because they can help with crowd control and those sort of things, because other people can also impede your ability to do first aid, and they can also be a danger as well. You often hear about paramedics getting assaulted and so on, and as mind-boggling as it is, they often will attend a situation perhaps where there are people who are intoxicated or under the influence of drugs, or just a highly emotionally charged environment. They're perhaps in shock. So other people can pose a danger as well. So if you've got people who can control that, that would be great. Often in the workplace, you'll have a first aid station or a first aid room. You take the casualty to the room where you're able to conduct your first aid treatment in relatively privacy. And also, the person may be, if they're conscious, if it's an injury where they're conscious, they may be a little bit self-conscious or a little bit embarrassed. So it takes a bit of that element out of it as well. Often we see where there's paramedics attending someone in a food court, for example, they'll often put up a big screen or curtain around them, because there's hundreds of people trying to have a look, and yourself when you're driving on the road, when there's an accident, all the traffic slows down because everybody just wants to have a look. So consider preserving the dignity of the casualty as well, where you can. Okay, so if we move on to response, and this is an important stage, because response will determine often the degree of seriousness of the injury. So primarily we're looking for conscious or unconscious. Okay, so unconscious person generally will be lying down. They're generally on the floor or on the bed or wherever the case might be. Highly unusual if the person is standing up and unconscious. However, just because they're conscious doesn't mean there's nothing wrong. In fact, most of the first aid situations you come across, the person will be conscious. Okay, they'll be conscious, but there'll be something wrong. They may be feeling nauseous. They may be feeling disoriented. They may have a break or a fracture or a soft tissue injury. They may have an overdose, or they may be under the influence of some substance, or they may have some heat stroke, or low blood sugar. There's a whole lot of things that the person may have from a little splinter in your pinky finger to really serious chest pain where you have perhaps the onset of a heart attack. All of those things happen in a conscious state. So the bulk of our first aid dealings is with a conscious person. However, there are situations where the person is conscious, but we regard them as having what we call an altered state of consciousness. So many of those examples that I gave, where the person has either taken too much of a substance, whether illicit or not, doesn't really matter. I mean, obviously some stuff is more potent than others, but it does pose a risk to their health and can be potentially fatal. So we would see some difference in their behaviour, some difference in their coordination, maybe their ability to respond to our verbal cues or our verbal commands, some difference in the way they move, and all of those things indicate that something is clearly wrong. The person can have perhaps disorientation through exposure to heat, particularly this time of the year in summer. We're in summer at the moment. Okay, long periods of exposure to heat, or low blood sugar, or maybe they've forgotten to take in their medication, and rather than taking too much, they're just not taking it where they need to be taking it. So a lot of those things can contribute as well. So basically, any time when the person is not responding in a way that they normally should, and an obvious one, a more common one, is in the case of a knock to the head. So whether it's a fall where you hit your head, or in a sporting situation where you've been hit in the head, So obviously there's the high risk of concussion, where effectively the brain moves in the skull, hits the wall, inside wall of the skull, and we get some bruising of the brain. Okay, and that can be a fairly serious thing. Okay, so concussion, the person needs to be monitored for 24 hours, and our initial analysis or our initial diagnosis would be to ask the person questions and see whether they can respond in a fairly clear and accurate way. So if they're a little bit foggy in their response, or a little bit answering a question which you didn't ask, for example, or giving you an answer which is nothing related to the question you asked, or their speech is slurred, or something like that, well, they're all indications that the person is suffering some concussion. The other thing to consider also is the reason we monitor them for so long in comparison to other first aid situations is we have a condition that we call delayed onset of concussion, where the person may seem okay now, okay, but later on, you know, they suffer some effects, and often it starts with headaches, really bad headaches and migraines and so on and so forth. The high risk, of course, is that there hasn't been any damage to the blood vessels in the brain, okay, which the person can become unconscious, and can be fatal. So we get to the third category, which is the unconscious person. So the unconscious person, again, generally on the ground or in the bed, we effectively try to wake them up. So we might call out their name as we approach them. If we know their name, if we don't know their name, we just call out, you know, are you okay? Can you hear me? Those type of things. Make contact, a light squeeze of the shoulder, a light shake, you know, and if there's any response, and their responses might just be opening their eyes and looking at you. Okay, so they're conscious, but obviously something's wrong. Where there's no response at all, and we say, okay, the person is unconscious, we need to call 000. We need to send for help. In our acronym, it's yes, send for help. Effectively means call 000. If I don't have a phone on me, then I call out to someone else, you know, to call 000 if someone else is there. If there's no one else there, then I need to go and do that. And in that case, I would need to leave the casualty there until I was able to do that. Okay, so it's very, very important, because we need to now get the paramedics there as quickly as possible. Okay, so make that call. If you've got a smartphone, a mobile phone, do it on speaker, and just put it on the floor, put it on the table, whatever the case might be, and you can continue, and they'll coach you through as well, because at this point you're probably feeling a little bit distressed because the person's not responding. You don't really know what's wrong. Okay, so one thing we need to consider when we say doctors, the A stands for airway. So is there something obstructing the airway which has caused the person, perhaps in this case, to be unconscious, or even in a conscious person where they're choking, for example? Well, choking is an obstruction of the airway. So where the person is conscious, okay, and there's an airway obstruction, they'll often be coughing. Okay, where they're coughing, we allow them to continue to cough. Okay, but we'll look at choking specifically in a different video. Okay, but the general basic rule of thumb is allow them to continue to cough, because that means some air is still getting in there. Where there's no coughing, that's a dangerous situation. Lips start to turn blue and so on. Person will often be clutching their throat. We need to put them in a position where we administer the back blows and perhaps the chest thrusts to try and clear that object. But again, we'll talk about more about that in the choking video. In the case of an unconscious person, we're looking for something that's obstructed the airway. So they're on the ground, we need to get them on their back, we need to have them head back, mouth open, very similar to the situation you have when you commence the breathing component of the CPR. We need to look into their mouth to see if there's something obstructing. Now, it might be anything from an object that's gone in their mouth, dentures, mouth guard, and so on. People often say food, but probably the more common one is their tongue. Okay, so the tongue can go down into the back of the throat. And one which is a little bit more difficult is in the case of the person who's anaphylactic and they get the swelling of the airways. Obviously we can't manually clear that. You need the EpiPen, you need the adrenaline in that situation. So we look for obstruction of the airways, we clear the obstruction. If we see an obstruction and we think we can clear it, we get the person on their side, okay, and we stick our fingers in there. Again, we've got our gloves on, or we might have a plastic scoop that we can scoop any object out, or even scoop from behind the tongue to pull the tongue out. not pull it out, but to stop it from obstructing the airway. And also we need to consider that sometimes the blockage is fluid, particularly if the person is on their back. In many cases of people unconscious on their back, choking on their own vomit, they regurgitate, but because they're on their back, it doesn't come out and they choke, and people have died from that. So again, you need to put them on their side, and that allows the fluid to drain out as well. Similar position when we put the person in the recovery position. So on their side, head tilted down towards the floor. All right, so let's assume that we cleared the airways or there was no airway obstruction. The next step in our doctor's ABCD acronym is breathing. And again, obviously that's critical because if we're not breathing, our heart stops. If we're not breathing and our heart stops, no oxygen going to the brain. And that's pretty much how everybody on this planet dies. The only way you can die, in fact, breathing stops, heart stops, brain gets no oxygen, game over. Okay, in a million and one ways that can happen, but effectively that's the end point for everybody. Well, obviously we don't want that to be the end point at this point, so we're trying to intervene. Okay, so we check for breathing. So we do what we say: look, listen, and feel. Looking for rise and fall of the chest. It won't be, huge and obvious, so it'll be quite subtle. Particularly if the person is not breathing deeply, they're still, so they're not running on a treadmill. They're not going to be huffing and puffing. So place a hand on the side of the rib cage. Place your cheek close to their nose and mouth, so we're feeling for any airflow, and also listening for any air escaping the body. It might be like a slight gasping or wheezing sound. We wouldn't consider that as breathing. And that's important for the purpose of the next step, because if we get to the stage where the person is unconscious and they are breathing, we put them in the recovery position, and then we go to our next priority, which is bleeding, particularly dangerous bleeding. We talk about arterial bleeding and those type of things where the blood is leaving the body quickly and the person can bleed out and die. Again, and we'll talk about bleeding more in our bleeding video, but that's our next highest priority. Dangerous bleeding or deadly bleeding, if you like, which will fit into our acronym. So when we get into our D at the end, but we'll come to that in a moment. Use your gloves, top to toe assessment. You've got your gloves on, you start at the head and lightly touch, because again there may be a head injury, and check your gloves regularly, because the person more than likely will be clothed and the clothing might be damp. Okay, now you need to check your gloves to see whether that's blood, okay, or whether they're wet, or whether they've wet themselves, which can happen. All of those things can happen. So continually check your glove for any signs of pink or red staining of the glove. In which case then we need to check the wound to see what the problem is, and then we look at how we can control that. Okay, but anyway, like I said, more about that when we talk about bleeding later. So the situation where the person is unconscious and not breathing now is a completely different one. Okay, so in the situation where they're unconscious and not breathing, we need to consider CPR, or we need to do CPR. And the other thing to consider with CPR is CPR works best when it's done in conjunction with defibrillation, which we've spoken about at length in our CPR and defibrillation videos. If you haven't had a look at them, do check those out, because they're very important. So in the situation, our acronym Doctors ABCD is slightly different at the CD juncture, if you like, depending on whether the person is breathing or not. So in this case, they're not breathing. So the C is CPR, the D is defibrillation. Okay, CPR is cardiopulmonary resuscitation, as you probably already know. So if we are the only person there and we do have a defibrillator handy, we need to go and get that defibrillator. Very important, we get that defibrillator on the person as quickly as possible, because they say for every minute there's a delay in defibrillation. Regardless of CPR, chances of survival decrease by 10%. Okay, so we need to get that defibrillator on as quickly as possible. If we're not the only person, if we have somebody else and there is a defibrillator somewhere in the building, okay, we commence CPR immediately, and we send the other person to get the defibrillator as quickly as possible, and we continue CPR until they return, and then we put the defibrillator on, turn the defibrillator on, and we go from there. Okay, again, check the defibrillator video and it'll show you what happens with that. All right, so that's the C and D for the situation where the person is unconscious and not breathing. When we get back to the unconscious and breathing, well then the C will be checking circulation. Okay, in the case like we took bleeding as an example, check the pulse. We don't check the pulse on the person who's not breathing anymore. Years ago we used to. Okay, but the pulse is important when the person is unconscious and breathing, because it indicates whether the person perhaps has an internal injury, internal blood loss. The blood pressure will drop, the pulse will get weaker and slower. So that's handy information to give to the paramedics when they arrive. Okay, that you've recorded the pulse, every minute or every couple of minutes or so to get a reading of the pulse, because that again can give some indication of what the problem may be. Because the person in normal situations shouldn't be unconscious, so obviously something's wrong. An internal bleeding or internal injury will sometimes cause that, and again it can be fatal. Signs to look out for there would be any fluid or any blood leaving effectively parts of the body it shouldn't be leaving at that point in time. Particularly blood, but it can be plasma, through the ears and so on, which is not necessarily red. So they're things to look out for. Another reason to have your gloves, because again, we assume everybody is potentially infectious. And then the D, as I mentioned previously, deadly bleeding or dangerous bleeding, any D word in front of it, which is going to fit your acronym, which is effectively arterial bleeding and internal bleeding, or even a significant wound, like a big wound where you can't just put a band-aid on it or put a pressure pad on it. You've got to try and apply pressure to control the bleeding, but this person may need surgery either for stitches or something more serious, where there's been, in the case of a fairly major wound, almost always you're going to get arterial bleeding, because the arterial network is the whole body. So if you have quite a deep puncture or quite a deep incision, okay, it's a fairly serious injury and the person needs hospitalisation. All right, so that's effectively your doctor's ABCD acronym. Now, we talked about some pretty serious things there, like CPR and bleeding and those sort of things. But in your workplace, the majority of the injuries in the workplace, or majority of first aid situations in the workplace, and even to a degree at home, are things like what we call slips, trips and falls. Okay, so you might slip on a wet floor, or you might trip over an object that's on the floor, or maybe just lose your balance. Of course, those things come with their risks as well, because you can fall and hit your head, and then we need to consider the potential head injury. But most of those situations create either maybe a fracture or a break at worst, or maybe a soft tissue injury, a sprain or a strain if you're involved in anything physical. Again, in the workplace it might be lifting an object which is too heavy, or lifting something incorrectly. Those sort of things are quite common, which causes sprain in the back and so forth. So again, it depends on the environment you're in. If you're in a sporting environment, and you're in a collision sport, obviously there are higher risks. If you're in a workplace where you're working with machinery, there's higher risks and different types of things that will go wrong in those situations. So you need to be trained in the things that are most likely happen in your workplace. Okay, the things that are likely to happen if you're working on the high power lines outside are different than if you're working at a computer in an office. Okay, the risks are completely different. So you need to be mindful as part of your risk assessment in your workplace of the sort of things that can go wrong, and then be trained in those things that are likely to happen, because they're the most common things you're likely to have to do. Okay, so anyway, I hope that clarifies or explains the doctor's ABCD acronym. You've probably got a couple of examples of your own. By all means, consider those and how they would slot into there. Okay, thank you.